AIDS. It has been over 30 years now since we first heard the acronym. The news reports began in 1981, citing a bizarre sort of cancer that seemed to be infecting gay men across the country.
We knew as early as 1981 that something was wrong, something was happening in the community, but we didn't quite know what it was.
The first Seattle case was reported in November 1982, and soon the acquired immune deficiency syndrome began infecting heterosexuals as well. An epidemic was on the rise, one which proved fatal in almost all cases.
In the mid-'80s, many of my friends were getting sick and dying very quickly, sometimes within a period of days or weeks.
As quickly as the epidemic spread, community organizations sprang up in response, all with the goal of saving lives and allowing the infected to be treated with care and respect. While AIDS cases topped 1,000 in King County, both the Northwest AIDS Foundation and Chicken Soup Brigade got their start. Activism by the local gay community ensured AIDS awareness occupied a place in the public spotlight. The second decade of HIV/AIDS saw case numbers rising significantly, locally and across the globe.
The community was being just decimated. My friends were dying left and right. I began to fear to go out to a local bar because the next thing you would hear was like, "Did you hear about?"
National awareness of the reach of the epidemic was emerging. High-profile cases drew media attention to the AIDS crisis as never before. Federal acts increased funding and better access to treatment for those infected.
One of my heroes is Ryan White. I wait for the day that I could just hug his mother for opening the door to the funding.
By the end of the decade, a vaccine research center had been created, placing greater focus on drug therapies, prevention, and the pursuit of a cure. The world ushered in a new millennium in 2000, and soon after, Lifelong AIDS Alliance was formed through the merger of Chicken Soup Brigade and Northwest AIDS Foundation. Chicken Soup Brigade had begun as a volunteer program to feed and care for HIV/AIDS patients across King County. It has since become one of the nation's leading medical nutrition programs, feeding nearly 1,000 clients a week.
Volunteers are the backbone of Lifelong. We could not do what we do without the volunteers. This is a staff of under 100 people, and we have almost 2,000 volunteers here day in and day out who serve meals, deliver meals, who help answer the phones, to a myriad of things that we could not do without them.
In addition to presenting the annual AIDS Walk and Dine Out for Life Day, Lifelong also provides medical case management, housing, and one-to-one counseling for high-risk individuals. Although treatment regimens and prevention programs were greatly strengthened early in the decade, new infections continued as advanced drug therapies lessened the concern over the fatal risks of contracting HIV.
You've got people who are still coming into this agency day in and day out who are newly impacted, who are newly infected, who may have been affected 5 years ago but now have lost a job, who need health insurance or need food. So the base of clients that we serve actually expands.
Without Lifelong, 2,600 people across the state would not have health insurance to be able to access care today. Without Lifelong, medical nutrition therapy wouldn't be available to 1,600 people every single year. Without Lifelong, people would not access housing. That's incredibly exciting ground to build on as we look to the future.
As the battle against HIV/AIDS enters its fourth decade, Lifelong AIDS Alliance continues to evolve and grow. Our work, our mission does not end until every last symptom is cured and every new transmission is eradicated. Lifelong AIDS Alliance needs you. Please donate your dollars and your time to help us fulfill our mission.